This video focuses on mild to moderate Alzheimer's disease, a condition that slowly damages memory, thinking, and daily function. The key story is how brain changes turn subtle forgetfulness into daily confusion. Remember, symptoms are brain-based changes, not bad behavior. Our goals are to define what mild and moderate Alzheimer's mean in daily life and connect brain changes to symptoms like memory loss and confusion. We will also cover practical signs for families to observe and discuss with healthcare professionals. Watch the symptoms, but respond with care and structure. In the mild stage, independence is often maintained, but memory and planning start to weaken. Moderate Alzheimer's usually requires more help with daily tasks, safety, and decision-making. Progression varies, so track patterns instead of adhering to a fixed timeline. Stages describe support needs, not a person's worth. Alzheimer's involves a progressive loss of brain cells and shrinkage in affected areas like the hippocampus and cortex. These areas are vital for memory, language, and reasoning. As networks weaken, a person may repeat questions or struggle with daily plans. Brain shrinkage explains why symptoms slowly expand. The hippocampus is crucial for forming new memories of recent events. When it's affected, older memories remain clearer than current events. This is why reminders, calendars, and caregiver cues are highly useful. Recent memory loss is often one of the earliest clues. The cortex supports higher functions like language, attention, and decision-making. As Alzheimer's affects these networks, the person may find complex tasks exhausting. Difficulties managing bills or following cooking instructions can appear before severe memory loss. Alzheimer's affects more than memory. Alzheimer's involves abnormal amyloid plaques and tau tangles, which interfere with healthy brain function. Over time, neuron communication weakens and brain tissue shrinks. The outward symptoms we see are the result of these invisible biological changes. Behavior changes have a biological cause. Mild symptoms include forgetfulness, repeating questions, and difficulty learning new things. The person can still manage many activities, but needs more support. Early changes are vital because planning and safety measures work best before a crisis. Do not ignore repeated daily life memory problems. A person may forget recent conversations or miss appointments. Older memories may be clearer than events from the same morning. Support should involve gentle cues, consistent locations for objects, and reducing memory-heavy demands. Use reminders without arguing about the mistake. Mild Alzheimer's can cause pauses and lost words during conversations. In the moderate stage, communication may become shorter and harder to interpret. Caregivers can help by speaking slowly, using simple choices, and allowing extra time to respond. Calm communication reduces frustration. Tasks with multiple steps, like cooking or managing medication schedules, become difficult. The person may lose the sequence or feel overwhelmed. Simplify routines with checklists, pillboxes, automatic payments, and focus on one task at a time. Reduce complexity before mistakes become dangerous. Poor judgment may lead to unsafe spending, vulnerability to scams, or medication errors. Insight and reasoning are also affected, meaning the person may not notice the risk. Discuss driving, money, and legal planning early while the person can still participate. Protect dignity while reducing risk. People may lose track of the date, season, or their location. Moderate Alzheimer's can cause deeper confusion. Visible clocks, calendars, routines, and gentle reorientation can reduce distress. Reorient gently. Do not shame the person. A person may put items in unusual places and be unable to find them, leading to frustration and suspicion. Use fixed home spots for essential items like keys and medicines, and label drawers if necessary. Design the home to make memory easier. Alzheimer's can cause anxiety, emotional swings, and irritability. These changes are often strongest when routines are disrupted or in unfamiliar environments. Look for physical triggers such as pain, fatigue, hunger, or infection. Behavior is communication. Search for the need behind it. The person may withdraw from conversations, hobbies, or social activities because tasks feel harder or conversations move too fast. Offer simple, familiar activities that match their current abilities, such as music, walking, or light chores. Adapt activities instead of removing them completely. Moderate Alzheimer's brings greater confusion and dependence, often lasting several years. Help is increasingly needed for bathing, dressing, and medication. Care planning is essential, as supervision needs can rise suddenly during illness or stress. Moderate stage is where care systems matter most. Deepening confusion may cause the person to confuse family members or misunderstand the caregiver's intentions. They may resist help if they feel rushed or threatened. Use short explanations, eye contact, and a calm tone to build trust. Remember, safety comes first, then explanation. Moderate symptoms affect daily living, including dressing, bathing, and hygiene. The person may still participate if tasks are broken down into simple steps and choices are limited. Preserve independence by offering guided participation instead of immediately taking over every task. Help the person do what they still can. In moderate disease, speech is less detailed, questions repeat, and understanding complex instructions declines. Body language, facial expression, and tone become key. Use yes/no questions, visual prompts, and one instruction at a time to reduce confusion. Simplify language, strengthen connection. Wandering increases, often when the person seeks a familiar routine or place. Risk is higher when doors are easily accessible or if anxiety is present. Use ID information, door alerts, and safe walking routines. Wandering is a safety need, not a discipline issue. Some individuals experience increased restlessness and confusion later in the day, known as sundowning. This disrupts sleep and increases risks. Consistent daytime activity, calm evenings, reduced noise, and good lighting help stabilize routines. Evening behavior often improves with predictable routines. The person may become suspicious, fearful, or agitated when confused. Arguments usually worsen distress. Validate their feelings first, saying, "That sounds upsetting. I'm here with you." Validation works better than confrontation. Behavior changes can stem from memory gaps, fear, pain, or sensory overload. The person reacts to a feeling without being able to explain the cause. Tracking time, triggers, environment, food, sleep, and medication changes can reveal patterns. A behavior log can uncover preventable triggers. Use a calm, respectful tone and approach from the front. Give one instruction at a time and offer 2 simple choices. Redirect gently with familiar music, photos, or a quiet activity when distress occurs. Calm structure is a treatment-like support. Establish predictable routines for meals, sleep, and appointments. Improve home safety with good lighting, reduced clutter, locked hazardous items, and fall prevention. Review driving, cooking, and finances before a serious incident. The safest home is simple, familiar, and predictable. New memory, behavior, or judgment changes should be reviewed by a healthcare professional. Problems like infection or medication side effects can mimic or worsen dementia symptoms. Assessment includes cognitive testing, lab work, and caregiver observations. Do not self-diagnose from symptoms alone. Seek urgent care for sudden confusion, rapid decline, fever, severe dehydration, or stroke-like symptoms. A sharp change over hours or days may indicate delirium or another treatable medical problem. Sudden worsening is a medical warning sign. Keep emergency information ready